Costocervical trunk. Questions and answers. Does the costocervical trunk arise from the subclavian artery? Yes, the costocervical trunk arises from the subclavian artery. From which artery does the costocervical trunk arise? Costocervical trunk arises from the subclavian artery. From which part of the subclavian artery does the costocervical trunk arise? Costocervical trunk arises from the second or third part of the subclavian artery. Is the costocervical trunk absent in 10% of humans? Yes, the costocervical trunk is absent in 10% of humans. Is the costocervical trunk more commonly found on the right subclavian artery than the left subclavian artery? Yes, the costocervical trunk is more commonly found on the right subclavian artery than in the left subclavian artery. Does the costocervical trunk divide? Yes, the costocervical trunk divides. The costocervical trunk divides. How many branches does the costocervical trunk divide into? Costocervical trunk divides into two branches. The costocervical trunk divides into two branches. Name them. Costocervical trunk divides into the deep cervical artery and the superior intercostal artery. Is the superior intercostal artery the highest intercostal artery? Yes, the superior intercostal artery is the highest intercostal artery.